Hello friends, today we are going to have a small discussion on the muscles of hand, and to make it interesting so that we don't forget in future, let's make it image based. So this is my hand and we're going to study the muscles of hand. Now we know how many muscles we have in a hand. We have 20 muscles, 20 muscles of hand. This is the thenar eminence, which has 4 muscles. This is the hypothenar eminence, which has 4 muscles. We have 4 lumbricals. We have 4 palmar interossei as well as 4 dorsal interossei. So let's start with the thenar eminence. The 4 muscles of thenar eminence are flexor pollicis brevis, abductor pollicis brevis AB, opponens pollicis and adductor pollicis AD. Let's come to the hypothenar eminence. We have flexor digiti minimi, abductor digiti minimi AB, opponens digiti minimi and palmaris brevis. And then, as I said, we have 4 lumbricals, 4 palmar interossei and 4 dorsal interossei. So I think we all are good in maths, right? 4 thenar eminence, 4 hypothenar, 8, 4 lumbricals, 12, 4 palmar interossei and 4 dorsal interossei. So the total muscles of hand, 20. Now let's see the nerve supply of these muscles. We'll start with the ulnar nerve. Okay, now the ulnar nerve supplies medially, right? So this means it will supply the hypothenar eminence. And how many muscles we have here? We have 4 muscles, right? So it will supply, ulnar nerve will supply 4 muscles of hypothenar eminence. Also it will supply 4 palmar interossei, 4 dorsal interossei and the 3rd and 4th lumbricals. The 3rd and 4th lumbricals. Now there is an interesting exception over here, which could be a possible question, is that we just now said that the ulnar nerve courses radially, right? So, medially. So, hypothenar innervation is there. Now there is one muscle in the thenar eminence or in the thenar compartment of muscle which is also supplied by ulnar nerve. And that could be a question, what is that muscle? That muscle is adductor eminence, AD. We revised recently that there are 4 muscles in thenar, right? Flexor pollicis brevis, abductor pollicis brevis, opponens and adductor, AD, adductor pollicis. So the adductor pollicis AD is supplied by ulnar nerve. So then what about the remaining 3 muscles? Well, the remaining 3 muscles of thenar compartment or thenar eminence is supplied by median nerve, MEDIAN. So now we move on to the median nerve. Median nerve supplies the remaining 3 muscles of thenar eminence plus the first 2 lumbricals, lumbrical 1 and lumbrical 2. That's it. So we are done with the muscles. We are done with the nerve innervation of all the muscles. Now let's see some of the clinical applied anatomy, which means we have the ulnar nerve innervation this side. So what is this? What kind of a sign is this? It's a claw hand, right? But it is partial claw hand. It's not completely. So you have to remember that the partial claw hand, also the cubital tunnel syndrome and Guyon's canal syndrome, which I'll be discussing in my next video, these 3 are because of the ulnar nerve. So if there's a question which say that which nerve is responsible or which nerve is being damaged, or the lesion of which nerve is seen in partial claw hand, in cubital tunnel syndrome and Guyon's canal syndrome, it is ulnar nerve. Okay. Now we also have the complete claw hand. For complete claw hand, remember that it is the nerve responsible for complete claw hand is both ulnar nerve as well as median nerve. So you have to remember both the names of the nerve for complete claw hand. Okay. Coming to the lesions of the median nerve. Now the median nerve lesion you will see in ape thumb deformity, or sometimes they also write that which nerve is injured in ape hand. So it is median nerve. Also the very famous and the very common question, million times it has been asked, that is in carpal tunnel syndrome, which nerve is injured, or the lesion of which nerve is seen. So it is the median nerve, because median nerve passes through the carpal tunnel. Also the hand of benediction or the benediction hand, median nerve is responsible for that. So when it comes to median nerve, we have to remember the ape thumb deformity or ape hand, benediction hand or hand of benediction, and carpal tunnel syndrome, right? Now you must have seen people like this, right? Kind of their wrist is dropped, which is also called as wrist drop in simple language. So which nerve is responsible for that? Now we know that the dorsum of the hand is supplied by radial nerve. It supplies the skin of the dorsum of hand as well. So in wrist drop, the nerve responsible is radial nerve. Also, we are all aware of Saturday night palsy or crutch palsy, and nerve responsible is radial nerve for that. So now we are done with the most common lesions of median nerve, ulnar nerve and radial nerve. Also remember that they could be image based questions, and they can just ask that which are unipennate muscles and bipennate muscles. So my friends, we know that we have just now studied about 4 lumbrical muscles, in which L1 and L2. L1 and L2 here refers to lumbricals and not to the lumbar vertebrae. Do not confuse yourself with that. So the L1 and L2 lumbricals are supplied by median nerve, whereas the L3 and L4 are supplied by ulnar nerve. So the L1 and L2 lumbricals are unipennate. They can give an image and say that which one is the L1 and L2 lumbricals. So you have to see it is unipennate. Okay. Also for L3 and L4, they can ask the nerve innervation, which we know is ulnar. Also they can give the picture and say which one is L3 and L4 lumbrical. So it is bipennate in appearance. So you have to see the muscles which are bipennate in appearance and mark according to that. Okay. The Palmar interossei 4 and the dorsal interossei 4, which we have revised just now. Remember that the Palmar interossei, there that is supplied by ulnar, right? Same with the case of dorsal, that is also supplied by ulnar nerve. But they can ask you the action of Palmar as well as the dorsal. So the Palmar interossei, remember, it does adduction. Like if we consider this as the axis, okay, so it adduction, dur jana, going far away, whereas the dorsal interossei, its function is abduction, pasana. So it will come close or near to the axis, abduction. That's it, my friend, for today. I hope you all like this, and I'll soon make videos on other anatomical topics. Thank you so much. Take care.